Child with special needs. Today in this we are going to deal with the topic Down's syndrome. The objective of this lesson is to impart knowledge on the basic issues concerning the Down syndrome. It is a classification, types, characteristics or symptoms, etiology or causes. The second objective is to plan developmental intervention programs for children with Down syndrome. For this, knowledge about the diagnosis, treatment and management is very much needed. Down syndrome is a set of physical and mental traits that can be caused by a genetic problem or gene problem that happens before birth. A child who has the Down syndrome tends to have certain features like a flat face, short neck. They can also have certain degree of intellectual disability. This varies from person to person, but in most cases this intellectual disability can be from mild to moderate. Down syndrome is a lifelong condition, but with care and support most of these children who have the Down syndrome can grow up to have a healthy and happy productive lives. Let us see in what is Down syndrome. Down syndrome, it is also known as trisomy 21. It is a genetic disorder. It can be caused by the presence of all or a part of third copy of the chromosome 21. It is typically associated with physical growth delays, characteristic facial features and mild to moderate intellectual disability. The average IQ of an young adult with Down syndrome is 50. That means his IQ is equivalent to a child with the age of 8 to 9 years. Down syndrome can be identified during the pregnancy by the prenatal screening followed by diagnostic testing, or sometimes after birth by direct observation and genetics testing. Since the introduction of screening, the pregnancies which have diagnosed with Down syndromes are often terminated. Regular screening for health problems is common in Down syndrome and this is recommended throughout their life. Education and proper care have been shown to improve the quality of life of the children who are suffering with a Down syndrome. Sometimes the children with Down syndromes are educated in typical school classes while others require specialized education. Some individuals with Down syndrome graduate from high school to senior secondary schools also. Sometimes we find them in post graduation schools also. Down syndrome is most common chromosomal abnormality which occurs in humans. 1 per 1000 babies in each year. Down syndrome is named after a scientist, John Langdon Down. He is a British doctor who fully described the syndrome in 1866. The genetic cause of Down syndrome, like an extra copy of chromosome 21, was identified by the French researchers in 1959. Although no one is sure why this Down syndrome occurs, and there is no way of preventing it. The only known reason is the mother who gets pregnant at a older age, like if the mother's age is around 40 years, then there is every chance of having a child with Down syndrome. Down syndrome is most common and readily identifiable chromosomal conditions. It is associated with intellectual disabilities. It can be caused by chromosomal abnormality for some unknown reasons. Sometimes an accident cell development results in 47 instead of the usual 46 chromosomes. This extra chromosome changes the orderly development of the body and the brain. In many important ways, the children who have Down syndrome are very much the same like other children. They have the same moods, emotions, and they are likely to learn new things, play and enjoy life. Now let us see what are the classifications. There are 3 basic types of Down syndrome. They are trisomy 21, translocation, mosaicism. All types of Down syndrome result from irregular chromosomes in some or all the baby cells. These irregularities are caused by abnormal cell division either in the egg or sometimes in the sperm before or after conception. First, we will see the trisomy 21. The older women who are at risk than the younger women of having the baby with trisomy 21. As woman ages, the chromosome in her eggs are more likely to divide incorrectly. So, this may result in the child being born with Down's syndrome. Translocation. This type of Down syndrome is passed down from the families. That means it is a inherited condition. But most cases the chances are evens. Although the total number of chromosomes in a normal child is 46, a part of chromosome 21 breaks off, or sometimes it attaches to the other chromosome and produces the signs and features of Down's syndrome. Mosaicism. This type is not inherited. Mosaicism results from abnormal cell division in only some cells after fertilization, while others divide normally. The cell that divides abnormally produces the 47th chromosome with extra genetic material from the chromosome 21. As the embryo grows, both normal and abnormal cells continually replicate. These are the different types of Down's syndrome. Now, what we will see what are the characteristics or symptoms of the child with Down syndrome. There are over 50 clinical signs of Down syndrome, but it is very rare to find all or even most of them in one person. The most common physical and developmental features of children with Down syndrome are the physical characteristics: diminished rate of growth and physical development. Most of the people with Down syndrome do not reach the average adult height. Atypical head shape. The head may be smaller than the average size. It is called microcephaly, with a flat area at the back, which is called occiput. Eyes that slant upward towards the edge of the face, and excess fold of the skin over the inner corner of the eyes. Sometimes they also have these white spots in the colored parts of the eye, which is called the brush field. Small or overfolded ears, flat nasal bridge, a small mouth with a low oral muscular tone and a protruding tongue. Short broad hands with short fingers and single crease spanning the width of the palm. And the last characteristic is decreased muscle tone. Now, we will see what are the developmental characteristics of a child with Down's syndrome. Delayed cognitive development, usually with mild to moderate range of mental retardation. Delayed or atypical speech and language development, with expressive language being more delayed than the receptive language. Delayed development of social skills. Delayed motor skills. Possible coexistence of developmental disorders or mental health or behavioral conditions such as attention deficit hyperactivity disorder, opposition deficit disorder, or pervasive development disorder, which is called autism. What are the medical problems associated with Down syndrome? Children with Down syndrome are at risk for short stature, congenital heart disease, frequent ear infections or other types of respiratory tract infections, hearing loss. Infants and children may have conductive loss as a result of middle ear infections or structural abnormalities of the ear or a sensory neural hearing loss, or sometimes you can find both of these types of ear infections. Eye problems including refractive errors, strabismus, nystagmus, cataracts. Congenital cataracts can lead to vision loss if not treated correctly. We can also find dental anomalies and gum diseases in the child with Down syndrome. Thyroid function also abnormal. Obstructive airway diseases such as snoring, unusual sleeping position, excessive fatigue or napping during the day, inattention, distractibility, behavioral changes. We can also find increased mobility of the cervical spine between the first and second vertebrae, unusual posturing of head and neck, change in gait, loss of upper body strength, abnormal neurological reflexes, change in bowel or bladder function, congenital defects of the gastrointestinal tract, higher incidence like for 1% of acute lymphoblastic leukemia than in general population. That means they have a chances of getting leukemia. The symptoms include excessive bleeding, bruising, pinpoint red spots at the bone or joint pain, and sometimes they also have enlarged lymph nodes. These are the problems a child with Down syndrome may also have. Now, we will see what are the causes of Down syndrome. Down syndrome is caused by a problem with baby's chromosome. All of us know that a person has 46 chromosomes, but in a child with Down syndrome, they have 47 chromosomes. In rare cases, other than chromosomal problems can cause Down syndrome. Having this extra chromosome or abnormal chromosome changes the way the brain and the body develops. Experts do not know the exact cause or risk of the Down syndrome. Normally, the risk of having a baby with Down syndrome is higher if the mother is above 35 years of the age, you have a brother or sister who has a Down syndrome, or if a mother has already a Down syndrome child, then is there every chance of the second child also to be a Down syndrome child. These are the risk factors that can have a Down syndrome child. How can a Down syndrome diagnosed? Prenatal diagnosis. A number of tests that can be used for Down syndrome with varying level of accuracy and invasiveness. The first and foremost is ultrasound. Ultrasound imaging can be used for screening the Down syndrome. Increased fetal nuchal transparency, that is called NT, it is an indicator for increased risk of Down syndrome. Ultrasound measurement of nuchal transparency is usually performed between 11 and 14 weeks of gestation. Blood test. Several blood markers can be measured that can be used as a part of combined test to predict the risk of Down syndrome. These tests include alpha fetoprotein, beta HCG, inhibin A, PAPPA or unconjugated estrol. The next test is amniocentesis and chorionic villus sampling, where the screening tests predict a high risk of fetus having Down syndrome. More invasive diagnostic tests such as amniocentesis and chorionic villus sampling may be performed. These tests have much lower false positive rate than the screening test. Therefore, they are more reliable in establishing the diagnosis of Down syndrome. However, they are invasive and carry slightly increased risk of miscarriage. Postnatal diagnosis. Clinical examination by a pediatrician can often confirm with diagnostic criteria, which includes 8 signs: flat face, ear dysplasia, tongue protrusion, corners of the mouth turned down, hypotonia, neck skin excess, epicanthic fold, and a gap between first and second toe. With the 6 to 8 characteristics, the newborn can confidently be said to have a Down syndrome. Now, after diagnosis, let us see what the treatment can be done to the child with Down syndrome. There is no cure for Down syndrome. However, many specific health and medical conditions associated with Down syndrome can be corrected or improved with appropriate treatment. In past few decades, advances in medical care have resulted in improved health and life expectancy for individuals with Down syndrome. It is also common that infants with Down syndrome are now referred to early interventional programs shortly after the birth. The goal of the interventional programs for children with Down syndrome is to maximize the child's developmental potential and improve the long-term functional outcomes of the children and their families. Regular medical care. Scheduling routine checkups helps the child to stay healthy. Doctors look for the specific problems at various ages, such as the cataracts or any other eye conditions during the baby's first year. Plastic surgery. Plastic surgery has sometimes been advocated and performed on the child with Down syndrome, based on the assumptions that surgery can reduce the facial features associated with Down syndrome, therefore decreasing the social stigma and leading to a better quality of life. Treatment therapies. A variety of therapies can be used in early interventional programs and throughout the person's life to promote the greatest possible development, independence and productivity. Some of these therapies are listed like this. Physical therapy. Physical therapy includes activities and exercises that help to build the motor skills, increase the muscle strength and improve the posture and balance. A physical therapist can also help a child with Down syndrome with physical challenges such as low muscle tone in a ways to avoid long-term problems. Speech and language therapy. Speech and language therapy can help the child with Down syndrome to improve their communication skills and use the language more effectively. A speech and language therapist can help them to develop the early skills necessary for communication, like imitating sounds. A speech and language therapist can help the child use alternate means of communication, such as sign language, pictures, until he learns to speak. The speech and language therapist should work closely with the child's caregiver to assist with generalization of therapy goals outside the therapy session also. What are the ways of helping a child with Down syndrome to develop his speech and language? Let us see some of the ways or tips. Teach the word and concepts with the use of actual objects and progress from concrete to abstract. Consistently check the understanding. Seat the student in a position that facilitates the use of prompts, cues and other strategies. Before initiating conversation, it is important to ensure that the student's attention has been secured. Use lower speech rate if necessary, as it facilitates the processing of information. It may be necessary to exaggerate and use gestures when helping the student with severe language deceptive disorder. Understanding the meaning of a word that symbolizes an object or an action. Depending on the age of the student, it sometimes helps to involve the students in selecting the strategies that can work best for them. Use pictures or photographs to reinforce and review the vocabulary that has been already taught. You can also use role play as a regular feature of language learning, as this helps alternate speaker or listener roles. An understanding of sentence is difficult for the students and often present in the classroom with difficulties in following instructions and poor oral comprehension. Give them simple directions in sentences to provide the students with experiences in understanding the sentences. These are the different ways for helping a speech and language development in a child with Down syndrome. Occupational therapy. Occupational therapy helps to find a way to adjust to everyday tasks and conditions to match the person's needs and abilities. This type of therapy teaches self-care skills like eating, getting dressed, writing, and using a computer. An occupational therapist might offer special tools that can help to improve everyday functioning, such as a pencil that is easier to grip. Emotional and behavioral therapies. Children with Down syndrome may become frustrated very easily because of the difficulty in communicating and may develop compulsive behavior disorders and may have attention deficit hyperactivity disorders. Emotional and behavioral therapies, they work to find the useful responses to both desirable and undesirable behaviors. These are some of the therapies that can be given to a child with Down syndrome. Next, we will see the education of a child with Down syndrome. The goal for educating the children with Down syndrome are same like normal child, to equip the child with Down syndrome to lead an independent adult life in the community. The social learning opportunities provided by the schools are important like the academic learning. Individuals with Down syndrome learn and develop at their own rate and in their own way. Education and therapeutic interventions can greatly benefit the child with Down syndrome. The children with Down syndrome have particular strengths and weaknesses associated with their learning. They are visual learners. They understand a lot more than they can say. They are able to follow the classroom rules and routines. They will need help to remember instructions. They have the same feelings like any other normal child. The teacher expectations of the behavior, attitude, and ability need to remain high. What can be the teaching strategies when teaching a child with Down syndrome? Teaching strategies. Inclusion. Inclusion is a good practice for students with Down syndrome. The inclusive environment is likely to stigmatize and provide much more natural environment for the students. There are more opportunities for peer relationships to occur, and much of the research states that full integration works much better. Self-esteem. The physical characteristics of the Down syndrome child will often result in lowered self-esteem, which means that you will need to take every opportunity to boost the self-confidence of the child. Intellectual. Down syndrome students usually face many intellectual challenges. Research has stated that most of the individuals with Down syndrome do not progress beyond the intellectual capabilities of a 6 to 8-year-old child. Solid intervention, high quality instruction have been proved to lead an improvement in the academic achievement of a Down syndrome student. Short attention spans are also prevalent among the students with Down syndrome. In short periods of time, along with smaller chunk of activities, will help and support their learning. Introducing new material slowly, sequentially, and in step-by-step fashion will help them to ensure maximum learning. Distractibility. Down syndrome students are often easily distracted. You will need to employ strategies that to work minimize and distractions, keeping the students away from the window or using slightly more structured environment, keeping the noise levels down. Speech and language. Down syndrome child also suffers from serious problems like the hearing difficulties and articulation problems. Sometimes they will require special speech and language interventional programs and a great deal of direct instruction. Behavioral management techniques. They are used for students with Down syndrome. Again, positive reinforcement is much better method than any other punishments. Reinforcements should be always meaningful. What impact does this Down syndrome have on a society? Individuals with Down syndrome are becoming increasingly integrated into the society and community organizations like the schools, healthcare systems, workforces, social and recreational activities. Individuals with Down syndrome possess varying degree of cognitive delays from very mild to severe. Most people with Down syndrome have cognitive delays that are mild to moderate. Due to the advance in medical technology, and individuals with Down syndrome are living longer than ever before. In 1910, children with Down syndrome were expected to survive to age of 9. Now, with the recent advancements in the clinical treatment and most particularly corrective heart surgeries, as many as 80% of the adults with Down syndrome are reaching the age of 60, and they may even live longer. So, this is the way how the Down syndrome child is being helped. So, today we have understood what is Down syndrome. It is a genetic problem having an extra 21 chromosome. We also have understood what are the different types of the Down syndrome and their characteristics, symptoms and diagnosis. And then lastly, we have tried to understand what are the different teaching strategies and helping a Down syndrome child. Hope you have understood the lesson and enjoyed it thoroughly. Thank you.